It is 7:44. Welcome back to WKYC Plus. When you hear the name Dr. Akram Boutros, you may remember the former CEO of MetroHealth, who transformed the hospital into a thriving center and later faced a public pay dispute. He has since been cleared of any criminal wrongdoing, and in the last few years, he's battled cancer and built a business. He joins senior health correspondent Monica Robbins this morning to explain this new project. Good morning, Monica.
Good morning, Danita. Yeah, Dr. Akram Boutros spent more than 3 decades leading healthcare, but he also spent time as a patient, most recently battling non-Hodgkin's lymphoma, and he joins us now. Thank you so much for being here, and it's wonderful seeing you in such good health.
Thank you. It's a pleasure being here.
We're going to talk about your business in just a moment, but I would be remiss if I didn't ask you, you're still dealing with a lawsuit regarding MetroHealth. Where does that stand right now?
We're still, the lawsuit is moving along. I had hoped with the number of gestures we've made to MetroHealth to enter mediation and a new board that it would be resolved by now, but it looks like we will be in the first quarter of next year, we'll be in court.
Wow. Does that surprise you at all?
It does. Having been cleared by 3 agencies, the county prosecutor, Ohio Ethics Commission, and Ohio Auditor of State, it would make sense for MetroHealth to have dealt with this lawsuit a lot earlier.
I want to ask you something else. You know, we're dealing with federal Medicaid cuts. We're dealing with state Medicaid issues. Mayor Bibb made a comment relating to the fears of MetroHealth shutting down because of these cuts. From your perspective, is that possible?
Look, anything is possible. I understand the financial crisis that they're in right now. Last year, $15 million loss. This year, they said it could be more. I'm not used to these numbers. I mean, my last year in 2021, the full year was $120 million of profit. But I understand the concern and the fear, because if the financial situation does not change, the bondholders will appoint a trustee that will take control of decisions. But I will tell you what I don't. What is confounding here is that I can tell you with certainty that due to the good work of the Ohio Hospital Association and Senators Husted and Moreno, and specifically, by the way, Cliff McGarrian, who's the not only the CEO of UH, but the head of the Ohio Hospital Association, MetroHealth will receive more than $100 million more in federal and state funds over the next five years. And so it more than covers the charity care that they're talking about, because the $1 million a day isn't cost, it's charges, and charges are less than the cost is a third of that. So I think with the additional dollars, they should be fine.
Let's move on to your business.
Sure.
Did you honestly come up with this business while you were a cancer patient?
So I did. So I will tell you, as I was always concerned about the lack of nurses on the inpatient floors, and I was worried about it. But when I was at MetroHealth, I got care there 8 times. I was an inpatient, and I was there for a week at a time. I saw the nurses 24 hours a day, what they were doing, and it was unbelievably cumbersome and not focused on the patient. So I said, we have to solve that.
And the name of the business, and what does it do?
So the name of the business is called Nexus Bedside, and it is the nexus of technology and personal care to patients. What we do is we provide inpatient care that utilizes virtual nurses and bedside nurses who actually change jobs on a regular basis, so every bedside nurse is a virtual nurse and every virtual nurse is a bedside nurse.
So this isn't home health care. This is far more advanced than that?
Oh yeah, this is in hospital. We take care of patients on med-surg floors. We take care of patients in emergency rooms. We take care of patients on surgical floors. We take care of patients who are step down.
So has this been launched locally yet?
It has been launched. It launched at OU Health, Oklahoma University healthcare system with extraordinary results.
And how's it working? You say extraordinary results, but how long has it been there, and how does it work?
So we began in July, and early July, and I can give you a couple of statistics. We reduced falls with injury by 100%. We reduced safety events by over 60%. We're saving nurses time so that a patient will be seen as many times as 15 times a day by a virtual nurse, and the bedside nurse gets to spend twice as long face-to-face with the patient. That results in much better patient care, and at the same time, we're saving more than $1,000 of nursing time per discharge.
Do you think that's going to catch on here locally?
I think so. We're very selective in which health systems we work with. They actually have to apply and be ready for that change because it's a complete nursing care transformation.
Anyone looking into applying locally, or you're going to tell us that?
I won't, but I will tell you that we've had discussions. Look, this is really important. When we studied what a nurse does on the floor, it turns out that about 30% of what they do is direct patient care. 30% can be done by a virtual nurse, a nurse that's not on the floor. 20% can be done by somebody else, and our artificial intelligence can help with all of that, and 20% is time wasters. So we want to eliminate the 40% and let the nurses really do what they went into the profession for, which is take care of patients.
So this could be the answer to saving the nursing shortage. All right, Dr. Boutros, thank you so much. You know, you and I will be talking a lot more about this in the future. All right, Danita, back to you.
All right, Monica, thank you so much.